Hello, my dear students. This is the most important time of the year when you're preparing hard for your exam. And pharmacology is one of the topic which you might be fear of. So here, myself, Dr. Saurabh Bhatia, have brought you 30 most important topic of pharmacology, which I think are most important for your examination 2024 January exam. So starting with the first topic, so I have chosen the first topic as a hematology, and in hematology, the first topic which I think is most important for your examination point of view is antiplatelet drugs. So the first topic is antiplatelet drugs, and at the end of this each topic, I'll give you one important extra bonus tip that may be asked in your exam. So antiplatelet drugs, the first topic. So we talk about this antiplatelet medicines. So we can divide antiplatelet drugs grossly in total four groups. So I can divide medicines grossly in total four groups, which are known as antiplatelet drugs. Number one drug is known as aspirin. So aspirin is the first drug, which is antiplatelet. Second group of medicines are known as P2Y12 receptor inhibitors. So these medicines, which are inhibitor of P2Y12 receptors, we also call them ADP receptor inhibitors. We also call them ADP receptor inhibitors. So we have aspirin, we have P2Y12 receptor inhibitor or ADP receptor inhibitor. Third medicine, third medicine is medicine which is glycoprotein 2B3A inhibitor. So we have a drug which is glycoprotein 2B3A inhibitor. And the fourth and the last medicine which may be asked in your exam is phosphodiesterase enzyme inhibitor. So we talk about these medicines. The most important point regarding aspirin is used as an antiplatelet in low dose. So we can use aspirin as an antiplatelet in low dose, and the low dose of this medicine is defined as 75 milligram to 325 milligram. So in this low dose, it is used as an antiplatelet. If we increase the dose, this will start behaving as antipyretic or anti analgesic drug, antipyretic drug medicine, or anti-inflammatory medicine. So in low dose, I will use this medicine as an antiplatelet. Now, the very important point which I have asked you in your exam already so many times, the mechanism of action of this medicine. So guys, please remember this medicine when given in this low dose, it's an inhibitor of COX-1 enzyme. It's an inhibitor of cyclooxygenase 1 enzyme, and this is a type of irreversible inhibitor. So this medicine is a irreversible inhibitor of COX-1 enzyme, and by inhibiting this COX-1 enzyme irreversibly, this medicine can inhibit the synthesis of thromboxane A2. So medicine can stop synthesis of thromboxane A2. So COX-1 is the name of an enzyme. When you block this enzyme, this protein, that is thromboxane A2 synthesis, will not take place. And now with the help of thromboxane A2, platelets will aggregate. Now this aggregation of the platelet will be blocked. So by inhibiting COX-1, this is inhibitor of thromboxane A2 synthesis, and therefore this medicine has antiplatelet property. Now next point regarding aspirin is the first drug. Aspirin is the first drug to be given in patients of acute MI. So in patients of acute MI, this is the first medicine to be given, and this medicine is given by oral route, and will tell the patient to chew the tablet. So patient is supposed to chew the medicine. The drug is given by oral route. Patient is supposed to chew the medicine, and whenever we give this medicine in acute MI, we have to give this medicine in a high dose, that is a loading dose, right? So we call it loading dose of the medicine. So what is the loading dose of the medicine? That is the maximum possible antiplatelet dose, that is 325 milligram. So patient will take the medicine by oral route, patient will chew the tablet, and patient will take the medicine 325 milligram by oral route, and patient will chew the tablet. It's the first drug to be given in patients of acute MI. Next point, because this medicine has an antiplatelet property, this medicine can stop the platelet aggregation. Medicine can stop the clot mechanism in the body. So if the patient has to undergo surgery, if a patient has to undergo surgery, this medicine can be stopped 3 days before surgery. So this medicine can be stopped 3 days before surgery if the patient is taking this medicine chronically. So if the patient is taking medicine chronically, patient can stop this medicine 3 days before surgery. But if the patient has recently started this medicine, patient has recently started this medicine, then there is no need to stop this medicine even before surgery. So patient has recently started, do not stop the drug. Patient is taking medicine since long time, you can stop the medicine 3 days before to avoid bleeding during surgery. Now let's talk about the medicines which are P2Y12 receptor inhibitor, or the medicines which are ADP receptor inhibitor. Now guys, here we have the medicines which are known as irreversible inhibitor. So we have three medicines which are irreversible inhibitor, and we have one medicine which is reversible inhibitor. So the medicine which is reversible inhibitor is obviously the MCQ that can be asked in your exam. So the medicines which are irreversible inhibitors, Medicines names are clopidogrel. Second drug is ticlopidine. So we have a medicines like ticlopidine, clopidogrel, and we have a drug prasugrel. So these three medicines are irreversible inhibitor. So their action lasts for 4 to 5 days. So medicines are irreversible blocker. So the action lasts for 4 to 5 days, and these medicines should be stopped. These medicines should be stopped 4 to 5 days before surgery. So medicine should be stopped 4 to 5 days before surgery. Second, the medicine which is reversible inhibitor. So the drug which is reversible inhibitor, medicine name is ticagrelor. So we have a medicine that is ticagrelor. So ticagrelor is a drug which is reversible inhibitor, and this medicine should be stopped, right? So one day before surgery, this medicine need to be stopped because this medicine is reversible inhibitor. Action lasts for comparatively shorter duration. So the irreversible inhibitors, clopidogrel, ticlopidine, prasugrel. How will you remember? You can remember with the mnemonic that is ticlopidine. So the mnemonic is ticlopidine. You can remember like this way. So ticlopidine, TI stands for ticagrelor and ticlopidine itself. CLO stands for clopidogrel. CLO stands for clopidogrel and P stands for prasugrel. So ticlopidine, clopidogrel, prasugrel are three medicines which are irreversible inhibitor. But ticagrelor is a drug which is a kind of a reversible inhibitor. Now let's talk about next medicine. Medicine which is glycoprotein 2B3A inhibitor. So the drug name is epsiximab. So we have a drug name is epsiximab. This medicine is the only antiplatelet which is given by IV route. So epsiximab is used only during acute emergency. It is given by IV route. We can remember by this mnemonic, like we can write ABC and followed by we can write 1, 2, 3. So we can remember like this way. This medicine is given by IV route and this medicine is inhibitor of glycoprotein 2,3. So it's an inhibitor of glycoprotein 2,3 given by IV route, and the medicine name starts with ABC, that is epsiximab. Last medicine, which is phosphodiesterase enzyme inhibitor. So we have a drug name is dipyridamole. So dipyridamole is a medicine which is one more antiplatelet medicine. It's a phosphodiesterase enzyme inhibitor, and the important side effect of this medicine is coronary steal phenomena. So important side effect of this medicine is coronary steal phenomena. So this medicine side effect is coronary steal phenomena. So medicine name ends with the word mole. So just remember a word mnemonic. The girl with the mole will steal your heart. So medicine side effect is coronary steal phenomena. That's the side effect of dipyridamole. So this is the classification of antiplatelet drugs. We have discussed their mechanism of action. Now, at the end of this topic, I want to give you one extra bonus tips. Now, where we will use antiplatelet medicines. So we'll use antiplatelet medicines wherever we find arterial thrombi. So wherever we will suspect the arteries are obstructed, for example, in patients of ST elevated MI, in patients of stroke, we know that coronary arteries or cerebral arteries are blocked by the atherosclerotic plaque or maybe the embolism which has come from the lower limbs. Now here we have to start the dual antiplatelet drug. So always start two antiplatelet medicines together. So we call it DAPT, dual antiplatelet therapy we always start. And most commonly we give combination of aspirin plus clopidogrel. So most commonly we use this combination of aspirin plus clopidogrel for arterial thrombi. This is all about the first most important topic which I thought can be asked in your exam January 2024, that is an antiplatelet drugs. Thanks for watching this video. If you really like this video, please share it with your friends and also subscribe for this channel. Thank you for watching this video.